Public health is the key to a nation's development. Healthy people make a healthy nation. Historically, health behavior in India have struggled to break free of myths and superstitions. In any country, media plays a central role in spreading awareness and in changing public opinion and behavior.
Health journalism is true empowerment of people, and I'm very passionate about health journalism because these are the journalists who make the public keep their health up.
And more than anyone else, it's the health writers who have to reach and the power to bring about revolutionary transformations.
How is it possible to get the message across to people? Now, no matter how much how many lectures can you give, how many places can you visit, here you have a message is properly given, can be spread to people in a way that they understand, and therefore I think it is an absolute essential thing, because the main thing is how do you empower people.
There was time though when health writing didn't wield as powerful an influence as it does now. A time when writers on the crime or political beats would double up as health writers. A time when only deaths and disease were reported. And this was not too long ago, just a decade back, or more precisely 2005, when things began to change. And things have changed considerably since then.
It has changed very significantly in the last 10 years, both in terms of the coverage, in terms of frequency, the space that has been given to the health news, as well as quality has changed.
The field has continued to evolve, contributing significantly to creating conversations around health. It is in this context that one must look at the development of advocacy platforms like the Health Essayists and Authors League, or HEAL. When it was established in 2005, HEAL, which has since been re-christened Health Education and Awareness League, set out with some simple aims and objectives.
We got together in 2005 in Goa. We said that okay, there is a need for improving the health writing standards in India, and that's how this whole concept of HEAL got started.
HEAL has so far organized over 150 workshops for health writers across the country. And with the annual national conventions, we have taken this to a different level altogether.
This is a work of almost 9 years when we started Health Writers Association called HEAL, where we brought all journalists covering health together on a platform to share their problems and to share their ideas and to share how the future road is all about.
मैं HEAL संस्था से जब इसकी स्थापना हुई तब से जुड़ा हुआ हूँ। मैंने देखा है बीते 13 सालों के दौरान HEAL ने चिकित्सा विज्ञान क्षेत्र से जुड़े पत्रकारों को सही समय पर ताज़ा तरीन जानकारियाँ प्रदान करता रहा है।
Ever since its inception, HEAL has looked at partnering like-minded organizations and individuals and has worked with some of the best minds in the country.
I have been in touch with the activities of the HEAL. I consider this forum very important for reaching out to the masses, reaching out to the people. We look forward to more interactions and conveying the right messages to the people.
The 4th National Health Writers and Editors Convention marks the beginning of a partnership with Indian Media Centre, which has been at the forefront of incisive journalism.
The Indian Media Centre works for professional excellence among media professionals across the country. We are delighted to have a fraternal collaboration with the HEAL Foundation. We felt that the kind of reach that they have, the kind of ideas that they have, that is suitable for a great synergy between our two organizations. When it comes to creating awareness in terms of information, education, communication, we together can work with government agencies both at the center and in the states and create awareness which is so critical for the success of all these ambitious programs being launched by the government.
If we try to remember the successful programs, you would immediately think of the programs done on AIDS, the program on polio eradication, the program on no smoking. These are the programs which come to our mind because they have been backed by a very well organized, orchestrated and a successful IEC campaign. When you think of the IEC programs today, these can never be successful without a constructive engagement of the health media into these programs.
All things considered, this is just the beginning. The job is far from being accomplished. We are on a mission, but we can't do it alone. We need your support so that we may together be able to build a healthy nation.
HEAL Foundation with partners like Via Media Health, Indian Media Center, Department of Community Medicine, AIMS, and we are seeking a partnership from the Ministry of Health too, that how we can create a concept like India Health 2020 and work towards a very specific goal which aligns with the government objectives to create a difference and bring in behavioral change within a time frame, within a timeline of next 5 years, that is by 2019, by 2020, how we are going to do an impact measurement and see that the areas where we have worked into have actually created a change. This we cannot do without support and partnership of all stakeholders, particularly the health media, this very proactive and positive government which has come at the center just recently. Thank you.